Alright, there it is.
I'ma wake up, do damage. Join number 7 Z's boredom. Ay, working on I need more though.
Hey everybody, welcome back to the channel. I'm Burke Selbst. I'm a physical therapist and the owner of Focus PT in Bend, Oregon. I work with climbers, athletes of all different sports here in Bend, and today we are talking about knees. Before we get into the video, please hit that subscribe button, tap the little bell for notifications, and that way every time I release a new video, you will get it first into your hot hands. All right, so let's dive in. Knee injuries are surprisingly common in climbing. So today what we're going to explore is 4 of the most common moves that can cause knee injuries. And I'm going to weigh in on what I think the most common move is associated with knee injuries, and I would be curious what your experience is. So be sure to leave a comment in the comment section letting me know what you've encountered, what you've experienced, what you've seen. First is our drop knee. So here we go. Here's a leg. We rotate that leg and we have our basic drop knee. So with this injury, what I typically see is quadricep, patellar tendon and muscle strain from a pretty extreme position, or I also see the potential for a ligament injury. And the ligament injury happens because of the twist of the rotation. If this femur rotates too far that way as this is dropping, it creates quite a bit of force in this direction, and that force is a notorious source of injury for the ACL, the anterior cruciate ligament in the knee. Second is the heel hook. The position itself isn't super radical, it's the muscular force involved. So we're seeing hamstring tendon. Those are the primary things that I see with the heel hook. The third is a rock over move. So rock over, we're going to get a high foot and twist that foot outwards away from the wall in order to lever this femur up and over the tibia. So the end result of a rock over is a position that's going to look like this, where there's good stability through that tibia, and that allows us to propel ourselves off of the foot. I see a combination of extreme rotation of this tibia coupled with the extreme flexion, and we're looking at internal structures with this. Meniscus, sometimes soft tissue, sometimes hamstring because of the stabilizing force that has to happen right there. And then the last typical move that we're going to associate with knee injuries is just a landing, either a fall or dropping down after doing a boulder, dropping and landing on the knee, putting force through the knee this way, rotating it, hyperextending it. And so for this last one, the injuries that could happen are, we'll just say, many. Now, for my observation on which one I think is the most prevalent, it's going to be just landing badly on the leg. The second one, and this might surprise you, it's actually not the drop knee, it is the rock over, for 2 reasons. One, the tremendous rotation of this lower leg in order to get your foot in the right place, coupled with the extreme flexions. So there you have it, 4 knee moves that can lead to knee injuries. I'm curious to hear your comments if you've experienced a knee injury climbing, or if you know people who have, what move in particular they were doing that led to that knee injury. Was it a fall? Was it one of these other 3 moves? Thanks so much for watching, and I hope to see you again real soon.
Is it